is Jordan Jackson, and I am so excited to share my final project presentation for the Gates Foundation Global Health Proposal. My project focuses on reducing maternal sepsis, which is a leading cause of preventable maternal death, through the delivery of clean birth kits and targeted midwife training in rural Tanzania. This project will be led by White Ribbon Alliance Tanzania, an organization with a strong track record in maternal health advocacy and implementation. The photo here on the bottom right is of Kigoma, one of the rural regions most affected by high maternal mortality rates in Africa. First, I would like to give a brief outline on what we will be discussing today. I will introduce our mission and grant proposal, then move on to the health endemic occurring in Tanzania. We will then discuss the project's three main objectives before reviewing how change will be measured. Next, we will examine key partnerships and future scalability, followed by the budget. Lastly, I will highlight the organizational capacity required for this project and conclude with the anticipated impact. The charitable purpose of this project is to reduce preventable maternal deaths from sepsis by equipping midwives and birthing women in Kigoma and Rukwa with the tools and training necessary to ensure safe delivery. This aligns directly with the Gates Foundation's focus on maternal health and sustainable development goal 3. White Ribbon Alliance Tanzania, with its long-standing partnerships with local ministries and nonprofit organizations, is well positioned to deliver this intervention effectively. The photo here shows a new mom in Kigoma, Tanzania. Moving on to defining the health issue. Maternal sepsis remains endemic in rural Tanzania due to inadequate sanitation, limited provider training, and restricted access to sterile delivery tools. Regions like Rukwa and Kigoma report alarmingly high maternal mortality rates, with up to 92% of postpartum women at risk of infection, and especially among teen mothers and those with limited education. Globally, maternal sepsis accounts for nearly 11% of maternal deaths, making this a critical challenge in low-resource settings. The map of Tanzania demonstrates the urgency of maternal mortality in this region, as the darker colors are increased maternal mortality ratios. Our three-part framework includes distributing 5,000 clean birth kits, training 150 rural midwives, and building an adaptive monitoring system to track outcomes. This structure supports improvements in access, quality, and innovation while reducing maternal deaths in underserved areas. For example, each kit costs about $15, yet provides the basic sterile supplies necessary for a safe delivery. Overall, this framework reflects the Gates Foundation's commitment to low-cost, high-impact innovations that expand access, improve quality of care, and can be scaled to benefit other high-burden regions. The top image on the right is an example of what the clean birth kits may look like, while the bottom image shows a midwife who assisted two mothers during a major flooding event in Tanzania. To ensure measurable impact, the project will track pre- and post-training scores, clinical practice change, sepsis rate, and kit usage. This answers some previous feedback I received by emphasizing not just training delivery, but the application of knowledge and improvements in care quality. Monitoring will be continuous, with monthly reporting from both health facilities and community health workers that will then be used to adapt training and distribution strategies if gaps are identified. Additionally, baseline data from 2024 clinic records will be used to calculate reductions in sepsis incidence, targeting a 40 to 60% decrease within the project period. Sustainability is built through collaboration with Tanzania's Ministry of Health, UNICEF, and local nonprofit organizations. The World Health Organization's clinical protocols guide the training content, while Africa's CDC's maternal health strategy is integrated into our model. In-kind contributions from Ministry of Health and UNICEF reduce project cost and increase ownership. Community health workers will be trained as peer educators to sustain knowledge and practices beyond the grant period. This project is designed to improve long-term access to quality care by embedding the training within Ministry of Health systems and by creating a scalable model that reduces cost over time. If successful, we will then expand this model across more regions and digitize the curriculum for broader access. The total project cost is $280,000 with $200,000 requested from the Gates Foundation. This budget reflects strategic investments in local capacity and materials with affordable per unit cost, $15 per birth kit and under $100 per trained midwife. Our in-kind contribution, such as free training venues and reduced supply costs through local procurement, further stretch donor dollars and ensure efficient use of resources. Partnerships can help reduce overhead and ensure cost effectiveness. White Ribbon Alliance Tanzania brings proven experience in maternal health advocacy and implementation. Our project team will include local community health workers, coordinators, and expert trainers supported by sub-awards to trusted community partners. The structure enhances local ownership, gender equity, and sustainability. White Ribbon Alliance Tanzania's prior success in maternal health campaigns demonstrates capacity to mobilize communities and implement evidence-based intervention. You can see a community health worker on the job in Tanzania in the image on the right. To conclude and go over impact, our vision is to create a replicable, sustainable model for maternal sepsis prevention in rural Africa. This project offers a powerful combination of simple technology and skilled human resources to save lives and reduce disparities in maternal health. We aim for a 40 to 60% reduction in maternal sepsis, improved delivery safety for over 5,000 women, and a long-term strategy for nationwide scale-up. By aligning with the Gates Foundation's priorities of cost-effectiveness, equitable access, and innovation, this project creates a sustainable model that can contribute to global reductions in maternal mortality. Here's another visual on the right demonstrating the major issue of maternal sepsis in Africa. Here I just kind of wanted to bullet point everything we went through and give a little overall summary. So in summary, maternal sepsis is a preventable cause of death that disproportionately impacts rural Tanzanian women. Our project addresses this through 5,000 clean birth kits, 150 trained midwives, and robust monitoring to track outcomes. By leveraging partnerships with Ministry of Health, World Health Organization, and local nonprofit organizations, we aim to deliver measurable impact and build a scalable solution that strengthens health systems long after this grant ends. This proposal reflects the Gates Foundation's commitment to maternal health innovation, scalable impact, and equity in global health. And then lastly, here are the references that supported the development of this project, all formatted in APA style. Thank you so much for listening. This was a really exciting project to work on. I found it difficult to try to kind of pull the essence of everything and compact it into one PowerPoint. So I appreciate any feedback, and I'm really looking forward to hearing all of yours. Thank you.